have to pass courses that relate directly to child and youth worker program, and if you don't pass those, then you don't move on. But having passed those, we're then saying to an agency, you can depend on this skill or this student to be able to do this, this, and this. So the placement is really a direct correlation to the academics that you've learned, and the expectation is certainly that you use those skills in an active way on a daily basis in placement, and there's a fairly rigorous evaluation that goes with that.
I'm Kerr, Coreykerr.
Okay, and can you tell me your job title? Or I think it's job titles, isn't it?
Yes. So like my places of employment?
Yeah.
Okay. I work at the Children's Aid Society in Windsor as a case aide. I also work at Glengarda Child and Family Services, and I work with the Greater Essex County District School Board as a child and youth worker and an early childhood educator.
Great, so you're actually...
Children's Aid, as a case aide, I go into homes and supervise court-ordered family access. I may have to redirect if there's inappropriate talk going on in the homes. If there's inappropriate behavior, I may have to intervene. We have high training in nonviolent crisis intervention, so I would be expected to use that training as well as my training as a child and youth worker in working with the families and collaborating to ensure that the visits are going according to their court order, as well as just being positive and having a positive outcome for the children as well as the parents, and supporting that positive visit. I may I may bring activities for the families to do. Some families are very low incomed, other families are very low functioning. So I may have to, bring games or craft activities or movies. I'll bring popcorn or stuff just as like a treat, and, just really show families how to engage in a positive way, how to spend quality time, because some families don't understand really what quality time is. They think just watching TV and sitting on a same couch might be quality time to them, but there's very little interaction. So I would encourage that interaction by bringing out a game or bringing out coloring books and crayons, and getting down on the floor with the children and just role modeling what parents should be doing with their children and families. It's very seldomly just children. Most of the time it's children and their families. The role with the school board, I am a supply staff at the moment, so I get called out to jobs. I go into the classroom. If I'm called out as a child and youth worker, I basically support and supervise the children during recess time. If there's any behaviors, I would support the children with the behaviors, support the teachers in the classroom if there's ruly behaviors going on within the classroom. If a child has been sent to the office, I would go to the office and support the children or child there, and do like problem solving, social skills, a lot of social skills, and just basically being a detective almost, really interviewing the child and trying to help them problem solve, by just asking a lot of, open-ended questions to get them thinking on how they can problem solve, and because their ideas will best suit their solution, as opposed to me just giving them the answers. So I do a lot of supporting in that sense. The role of a child and youth worker in a school is different from the role of a teacher by the teacher is there to mainly support the learning and education aspect of the child, where the child and youth worker is there to support the behavior, social skills, and problem solving for the children. Yes. Basically what I mean by supporting a child with problem solving is asking a child, what happened in the situation, how did that situation make them feel, how do they feel the other person felt in that situation, what are some things that we could do to make the situation different, what are some different outcomes that could happen in the situation. So, if you chose to do it this way, what would happen if you did it this way? Or if you chose to do it that way, what would happen if you did it that way? What do you feel would work best for you? What do you think you can do to help this situation? What are some things that you could do that might make the situation worse? Is the situation big or is it small? And put it on a scale level in that sense. So pretty much like that. In the program, we do a lot of role play. A ton of role play. We do a lot of role play where we're practicing active listening, repeating what the person's saying. We practice asking open-ended questions because you can become very constricted in asking closed questions, the yes and no answers. And in the Child and Youth Worker program, we were trained to steer away from that and ask a lot of open-ended questions to get the person really thinking and kind of creating their own answers as opposed to being dictated what they should say. We did a lot of case studies to brainstorm scenarios and also role play from those case studies to learn how to talk and basically counsel and support clients, children, families to adequately ask them the questions and support them through their problems or situations. That would, because I was in the Child and Youth Accelerator program, I did not have a lot of training in child development. That I had a ton of training in the early childhood education program. That was basically the fundamentals of early childhood education was the child development. So I have a lot of training in that on how to differentiate the age groups and simplify or modify in those situations. But in Child and Youth Working, we learned a lot through our clinical psychopathology class on different developments of children and adolescents and even adults, because even in this field, it's mainly geared towards child and youth, but you're also working with adults if you're working with the families. So we have to have some type of foundation on adults and families. And in the clinical psychopathology course, we learned a lot on learning disabilities and mental health, which can really differentiate the development in a person, which trains us and teaches us how to talk within those levels in that criteria. It's children's mental health. It is, I work in the day treatment of children's mental health from ages 6 to 12 years old. And I started out working on the Therapeutic Crisis Intervention Program, which is a team of child and youth workers. And basically what our job requirements were, if a child was going into crisis or were in crisis in a classroom and could no longer be in the classroom, they would be removed from the classroom or we would go in and support them in the classroom. But if they become violent or aggressive and we're no longer safe to be in the classroom, they would be brought into another room, and we would do a lot of crisis intervention with them. So we would do like safe classrooms, safe bodies, a lot of social skills, teaching them how to appropriately behave in a classroom if they don't have those skill sets, how to, get along with friends and other children and peers, how to be a friend, how to, what the role of a classmate is in a classroom, so what the role of a student is, and teach them and support them on that, giving them that skill set. If they're experiencing a lot of anger and behavior outbursts, we would do a lot of anger management and anger behavior programming with them that would be individualized to that child. And as well as we would prepare, create, implement programmings to suit the needs of the children in specific classrooms. So if a classroom needed lessons on social skills, we would create a social skills program and go into the classroom a couple times a week and fulfill that program with the students. If it was behavior management that was needed in a classroom, we would go and create that program to specifically gear to those set of children in that classroom at that moment. So it's very moment by moment, day by day, individualized planning, intervening, and supporting. I came into the profession mainly because I grew up in the system. I myself was a foster child. I also suffered from mental health during my adolescent years and was in group homes. So I worked very closely with child and youth workers. I came into care because I myself was a victim of child abuse and trauma. And that's pretty much where my heart and soul comes from and what led me into this program. I feel there are some changes that need to be made in the program or in the field itself, and it would be easy for me to stand on the opposing side and just criticize and critique it, but for me to actually come into the field and work and be an advocate and actively participate in the field and help be part of that change was so much more greater for me. To work in children's mental health and in treatment and say, this is where the system can be improved, let's try it this way, and role model through how I feel child and youth workers can truly make a difference, how they could have made a difference in my own life by role modeling that and showing people how I wish child and youth workers treated me and worked with me, by me doing that and fulfilling that through children that I work with now in mental health. Yes, advocacy is highly important. I feel that society shies away from child abuse and trauma in children and don't always feel comfortable hearing and listening to the voice of a child. And I feel that it is so highly important and crucial that children are heard and their voices are respected, and that what they're saying not only is heard, but is supported and worked through. And I feel that that's my role, to bring voice to that and bring voice to these children and bring voice to the very topics and subjects that people shy away from in community, in society, and don't want to necessarily look at because it's so complex and so heart-wrenched. But that is what child and youth work is about. And that is the heart and soul of it, bringing voice to the children, supporting and advocating for them. And that's what my job is as a child and youth worker.
There it is.
My name is Heather Martin, and my daughter's name is Avery Martin.
Can you spell both?
Yes, HeaterMartin and Averymartin.
And what is your job title?
I am a foster parent. It started working with other foster parents. I would go into their home and offer support. We did relief, and that came after graduating from the Child and Youth Worker program. Eventually, after having children in our home so often, my husband and I decided that we wanted to make it our full-time, life-changing job. And I think it's become more than a job. It's our life. And having children come into our home and be part of our family is not just what we do anymore. It's our family. It's who we've become as a family. I can't imagine doing or being a foster parent without having had the experience as a child and youth worker. Children come with so many experiences, and their backgrounds of trauma is so extensive. And having that understanding of where they've come from and why their behaviors are the way they are. We often try to treat the behavior, and we forget to treat the child. It's often, you would think of someone who has a cold, and you can try to get rid of the runny nose. You can't get rid of the runny nose until you understand, is it a cold? Is it a flu? Is it something more? And having the clinical piece of being a child and youth worker, we're able to take the children in, give them the nurturing, give them the support, give them the structure, but also take the element of needing to figure out and investigate why and where it's coming from. And so being a CYW first and foremost has really helped us prepare and plan and have a treatment strategy for the children that enter into our home. I think that can take on many different, it has many different roles at different times. We've had children come in who need to be nurtured and want the component of a mom and dad and a forever family. There's other children who come into the home and who are very clear that I'm here because I have to be here, and but I don't want to be here. I think depending on the child, it takes on a very different role. Children come in for short periods of time. Children may be staying for long periods of time. And I think depending on the needs of the child is what we try to offer. Some really need that forever family, and it's nurturing, and it's being a mom. And for others, it's being a mentor. It's being a supportive piece in their journey towards returning home or maybe transitioning out of care. So our family has been many different things for many different people and many different children throughout the years, depending on where the needs are at the moment. Some days it's chaotic, and some days it's lovely. As with most families and most large families, it starts early in the morning trying to get everyone up and ready and out the door. The lovely piece for us is that many of our older children have been with us for a long term and know the routines and are really good at helping with the younger children. And as with any family, there's moments of harmony and there's moments of dysregulation. So it's getting everyone up and out and to school. And I think the big piece is the after school. Everyone coming home, everyone doing homework, everyone working together to get dinner on the table, and then sharing a meal and sharing the stories of the day, which I think then helps transition into evening programming, which could be stuff in the community or sitting around and doing stuff as a family before bed. So I think essentially it's in our capacity as a family, probably very similar to a lot of families, that there's moments of greatness and there's moments of struggle.
What's the best part for you?
About being a foster parent? I think seeing change. I think feeling impact. Children have the capacity for so much. And when you give them the tools and when you give them hope, it's amazing what children and how resilient children can be. And I think seeing those pieces, having children be able to teach me that there's hope and that we all have the capacity to be resilient and to overcome, has been huge.
What's been the most challenging?
I think not being able to reach in and save everyone. I think not being able to have a magic wand and make it better. That the bottom line is we're dealing with children who have come from traumatized backgrounds and who, because of behavior, have had move after move and placement after placement. And so they come to us at times and to other foster homes just not able to attach. And so I think that that's the biggest struggle, is that as much as we want to reach out and hold them and hug them and love them, it's about getting them to a place of being able to accept that. I think some of the emerging trends that are coming into the field these days is a big holistic piece, that we no longer look at a child as being singular, but we need to start looking at them with all of the systems that involve them. So that's in the education system, it's with their families, and for some children, that's multiple families, and what does that look like? In the community, and how do we, as a society, embrace that and help them move forward? And I think for child and youth workers, wherever you're coming from, be it going into foster care, into residential, into treatment, it's remembering that the child is more than just one facet, that they're made of many different facets. And in order for us to heal and to help complete them, we need to take all of the different pieces and help put that puzzle together for them. So Avery, in the last little while, you've had to spend a lot of time in and out of hospitals. And while you've been in the hospitals and while you've come out of the hospitals, you've had a child and youth worker who's been able to work with you.
Yes.
Could you tell me a little bit about what a child and youth worker did while you were in the hospital?
Well, what the child youth worker did was came and helped me out, and we did a few activities in the hospital.
Yeah. And there was a moment right after your surgery where you were in a lot of pain. And tell me some of the activities and some of the things that the child and youth worker brought to you to help you out with that.
Well, the child and youth worker brought me a pinwheel to blow when I was mad, and a ball to squeeze when I was in a lot of pain.
Yeah. Which was pretty cool, wasn't it?
Yes.
And that was one of the things that I noticed, that when you were able to blow the pinwheel, it helped to calm your breathing down, and you were then able to tell us what you really needed. Mm-hmm. And what were some of the other things that the child and youth worker did while you were in the hospital?
She gave me this Wii system that I could play Wii on.
That's right.
And I played with my brothers and my sister and brothers.
That's right. That was pretty cool, wasn't it? And you got to keep that in the room for the whole time you were in the hospital. Very neat. And coming home from the hospital, you've had a couple of child and youth work interns come and visit you in the home and do some stuff with you in the home. How is having a child and youth work come into the house? How does that impact you? How does that make you feel when you've got someone to spend just time with you alone?
It feels pretty good.
Yeah. And what do you do with your CYW?
We play activities and do arts and crafts.
You do lots of arts and crafts. Is there ever times where you're feeling really frustrated or mad that you get to have some time talking about that?
Yes.
Yes. So do you find that your child and youth worker gets to or takes the time to listen to you?
Yes.
Yes. And what else does your child and youth worker do? So say you're really, really, really mad. What are some of the things that they might talk to you about?
They sometimes talk to me about ways how to calm down.
Oh, wow. So you get to talk about the ways that you can calm down. And do you find that that helps sometimes?
Yes.
Yes. And do you practice some of the things that your child and youth workers told you?
Yes.
Perfect. What